Drug Therapy for Genitourinary Diseases and Disorders. Welcome to today's lecture on drug therapy for genitourinary diseases and disorders. In this session, we will discuss various medications commonly used to treat conditions affecting the genitourinary system. These drugs play a crucial role in managing and curing infections and other issues related to the urinary and genital organs. We will cover the following medications: Sulfisoxazole, Trimethoprim, Cotrimoxazole, Sulfamethoxazole, Ampicillin, Tetracycline, nitrofurantoin, methenamine mandolate, and phenazopyridine. Let us start with Sulfisoxazole. Sulfisoxazole is an important antibacterial agent used in drug therapy for genitourinary diseases and disorders. Sulfonamides, to which sulfisoxazole belongs, are highly effective in treating a wide range of initial infections. The recommended dosage for sulfisoxazole is a loading dose of grams by mouth, followed by 1-2 grams by mouth 4 times a day for a period of 10 to 14 days. Adverse reactions to sulfisoxazole may include nausea and vomiting, pain, arthralgia and joint pain, crystalluria, the presence of crystals in the urine, renal damage, liver damage, serious blood dyscrasias, general morbid condition of the blood. Sulfonamides should be avoided in certain cases, including 1. Pregnant women at term and nursing mothers. 2. Individuals with impaired renal or hepatic function. 3. Patients with hemolytic anemia. 4. Individuals hypersensitive to sulfonamides. 5. Patients using sulfonamides should maintain an adequate fluid intake to prevent crystalluria. Our next drug is Bactrim or Septra, a combination of 2 drugs, Trimethoprim and Cotrimoxazole Sulfamethoxazole. Trimethoprim and Cotrimoxazole Sulfamethoxazole are medications indicated for the treatment of chronic urinary tract infections. The dosage for these drugs is 800 mg twice a day for 10 to 14 days. 3. Ampicillin. Ampicillin is a broad-spectrum antibiotic effective in treating genitourinary infections. The recommended dosage is 25 to 500 mg every 6 hours for 10 to 14 days. Adverse reactions to ampicillin are limited to sensitivity phenomena, and the contraindications are individuals known to be sensitive to penicillin. 4. Tetracycline. Tetracycline is a broad-spectrum antibiotic, effective against various bacteria, mycoplasma, rickettsia, and protozoa. The recommended dosage is 250 mg by mouth every 6 hours for 10 to 14 days. Adverse reactions may include gastrointestinal disturbances, skin rash, renal toxicity, and hypersensitivity. Tetracycline should be used with caution during pregnancy, as it may cause dental discoloration and bone growth inhibition. 5. Nitrofurantoin. Nitrofurantoin is used for short-term preventive and long-term suppressive therapy in chronic urinary tract infections. The recommended dosage is 5 to 100 mg 4 times a day for a 3-day period. Adverse reactions may include gastric disturbances and hypersensitivity reactions. Contraindications include anuria, oliguria, renal impairment, pregnancy, infants less than 1 month old, and known sensitivity to nitrofurantoin. Methenamine mandolate, also known as mandelamine. Methenamine mandolate is used as a prophylactic and suppressive treatment of bacteriuria through urine acidification. The recommended dosage is 1 gram 4 times a day for 3 days after urine is sterile. Adverse reactions may include mild gastric irritation, urinary tract inflammation in higher doses, and hypersensitivity reactions. Methenamine should not be given to patients taking Bactrim or Septra, as they may interact adversely. 7. Phenazopyridine, also known as pyridium. Phenazopyridine is an analgesic indicated for pain associated with urinary tract irritation or infection. The recommended dosage for adults is 100 to 200 mg by mouth 4 times a day after meals for 3 days if the pain is relieved. Adverse reactions may include headache, rash, pruritus, occasional gastrointestinal disturbances, staining of contact lenses at high doses, and in overdose, hemolytic anemia, and renal, and hepatic toxicity. Patients should be warned that this drug can color the urine red to orange and stain fabrics. These medications play a vital role in the treatment of genitourinary diseases and disorders. It is essential to consider the dosage, adverse reactions, and contraindications for each medication and to use them with caution to ensure the best outcomes for patients. Thank you for listening to this audio lecture. We hope you found it informative and helpful. If you're a nursing student or healthcare professional, we encourage you to subscribe to our channel for more summarized nursing lecture notes and other related healthcare courses. We have a wide variety of topics available, and we're constantly adding new ones. We also want to hear from you. Please leave a comment below with any course or topic you would like us to cover in the future. Thanks again for listening.